Dear audience, welcome to the final module of the massive open online course on MPI. This module focuses on the application of a multidimensional approach to poverty into the COVID-19 response. My name is Abdoulaye Mar Dieye, and I'm currently the United Nations Special Coordinator for Development in the Sahel, formerly Special Advisor to the UNDP Administrator, leading on the socioeconomic response on COVID, and Director of Bureau of Development Policy, and in my other incarnations, Director of the UNDP Regional Bureau for Africa. In the next 8 to 10 minutes, I would like to share with you some of the lessons learned in the past year with the COVID-19 response. 1 year after the pandemic, we are living unprecedented times. This is more than a health crisis, as António Guterres, the UN Secretary-General, used to say. This is a multi-crisis with severe impacts on people, on the planet, on the economies, and on governance systems. Worldwide, what we call NPIs, the non-pharmaceutical interventions, including lockdown measures, restrictions of movement of people and goods, closures of schools, all were put in place to prevent the spread of the COVID-19 virus and to flatten the curve of the pandemic and to reduce the pressure on public health systems and with socioeconomic consequences. We are seeing some positive effects, and we have to recognize it and salute it and celebrate it. But the road to travel is still very, very steep and long. My lecture today will briefly cover 3 points. Number one, what is the global status of poverty in the world post-COVID-19? Number two, how the UN responded to the challenge. And here I want to make the case of a multidimensional approach to COVID-19 response and recovery. And number three, finally, I will explore some examples of countries that successfully incorporated relevant indicators to assess COVID-19 impacts. Let me give you a general context. So what is the global status of poverty in the post-COVID-19? Globally, our projections done by UNDP, Bureau of Policy, are showing a very disturbing picture. First, for the very first time in 20 years, poverty is rising due to the pandemic. And based on income measures, the World Bank forecast indicates that additional 150 million people could be pushed into poverty by the end of 2021. 8 out of 10 new poor will be in middle income countries. But the majority of the income extreme poor will be still concentrated in low income countries and in sub-Saharan Africa. Second, based on a study done by UNDP and Pardee Center at University of Denver, under what we call a high damage scenario, we have learned that severe long-term effects of the COVID-19 pandemic could push an additional 207 million people into extreme poverty. And this on top of the current pandemic trajectory, bringing then the total number of poor to over 1 billion by 2030. This is quite tectonic and phenomenal. Third, the trends we are seeing are pointing towards a 6-year regression of human development worldwide. And this has never happened in the past. So the crisis is hitting hard on all human development's constitutive elements, on income, on health, on education. Let me deconstruct a little bit further. On income, we are living through the largest contraction in economic activity since the Great Depression. On health, the pandemic has caused over 2.5 million deaths, and with over 113 million confirmed cases across the world. And these are the data we got from the WHO, World Health Organization. On education, school closures are still in effect in many countries. UNESCO data show that worldwide, 2/3 of an academic year have been lost on average due to COVID-19 school closures. Today, over 800 million students, so more than half of the world's student population, are still affected by these disruptions. 31 countries have full school closures in place, and another 48 countries have part-time closures. The inability of schools to transfer to online training and of students to access to internet have increased the learning gap across countries and within countries. Primary education is expected to drop to the levels of actual rates of the mid-1980s. Interestingly, and this is to be signaled, 3 countries, Costa Rica, Dominican Republic, and Panama, have used access to internet as a critical indicator for computing their MPIs to access living conditions. And these are examples to emulate. Now, how did we at the UN respond to these challenges thus far? The COVID-19 crisis has revealed the unsustainability of the pandemic development path. But while all countries have been affected by the pandemic, their capacities and ability to respond are differentiated, and vulnerabilities and impact are not equally distributed. Those individuals that were in a vulnerable situation prior to the pandemic outbreak are now facing a worse situation scenario where the pandemic is compounding the effects of pre-existing inequalities, climate impacts, and conflict. To respond to the ongoing crisis, the United Nations put in place what we called the UN Framework for Immediate Socio-Economic Response to COVID-19, to leave no one behind, and guided by the imperative to understand the following. Number one, who has been targeted when devising the country health and socioeconomic response measures? And what is the demographic and where do they reside? Where are the gaps? Number two, which barriers keep people beyond the reach of infrastructure, of employment, services, of jobs, and other socioeconomic measures? Number three, how can those who are excluded, marginalized, and vulnerable come into the fold? How can they be made more resilient to shocks and crises? How can the responses help remove and avoid exacerbating structural drivers of exclusions, inequalities, and discrimination? To ensure the immediate response reaches all those in need, therefore, a quick but comprehensive mapping of those most at risk of being left behind is critical. This includes assessing how they are disadvantaged by multiple forms of inequalities and discrimination. To understand those who are frequently left behind, we need country-specific assessments, and that would include socioeconomic, institutional, and geographic information before and after the crisis. Now, our response, which has been led by UNDP, has been guided by the following elements. Number one, we said that, and that's a principle, personal situations and status matter. Some groups indeed are more affected than others by the pandemic. At least 14 plus groups of individuals have been hard hit by the pandemic and are considered at-risk populations group. These include those working in the informal economy and with inadequate or no social protection, those with inadequate access to social services, those that have limited access to services due to their age, their gender, race, their ethnicity, religion, or migrant status. And all these characteristics or vulnerabilities, they do intersect. Number two, occupation matters. And we have seen that frontline workers, informal workers, those working in food production and supply chains, including migrant agricultural workers and construction workers, service sector and gig economy for transport and delivery of goods, all these are all working in precarious conditions and have been enduring severe socio-economic impacts from the crisis. Location matters. The crisis will indeed exacerbate inequalities, especially in vulnerable settings that lack adequate services and infrastructure, such as hand-washing facilities. We have seen it in many poor countries, or that offer ability for social distancing practices. Well, this includes refugee camps, and all our UN agencies are working in those refugee camps also, informal settlements and slums, neighborhoods with precarious infrastructure, prisons, and immigration detention centers, rehabilitation centers, and fragile locations, rural areas and indigenous communities, and so on and so forth. Legal status of individuals matters. Lack of legal identification, which affects 1 billion people globally, the situation of those forced to leave their homes, the stateless people and people living in camps, people living in informal settlements must be considered. And trust matters. Lack of trust in governments can hamper the development and implementation of an inclusive, equitable response, leading to breakdown of social cohesion. And we have seen that in many countries that as the pandemics would evolve, the trust space has been contracting and contracting. And finally, so how MPI can be used to integrate relevant COVID-19 dimensions to vulnerable groups. As I said earlier, UNDP has been privileged to be asked by the UN Secretary-General to be the technical lead in steering the design and implementation of the UN socio-economic response to the COVID pandemic. At the very outset, we realized, after conducting some 145 plus countries COVID socio-economic impact assessment, that business as usual would not get us out of the grooves we are, and that we needed to be guided by a practical approach of system transformation to steer a UN response that addresses the multidimensional impacts of the pandemic. The coronavirus discriminates based on socioeconomic status. So a multidimensional approach to poverty can help countries design a COVID-19 recovery that is people-centric. So this is a unique tool that comes extremely handy to map what's happening and to design the appropriate policy responses. Evidence shows that those considered multidimensionally poor prior to the outbreak of COVID-19 are likely and highly likely to be hardest hit. For example, this can be tested by simply overlaying the COVID-19 epidemiological data with the MPI data available at subnational levels. And we have illustrations that show that. Nevertheless, a big challenge is that many vulnerable or marginalized groups, for example, mobile slums and informal squatter dwellers, or migrants and refugees, or those in detention centers, who generally are more exposed and at risk, are typically excluded from the household surveys that are commonly used to produce national MPIs, such as the living standard surveys, the labor force surveys, the demographic and household surveys, and others, and I'm sure you are quite familiar with those surveys. Therefore, additional, more targeted individual surveys may be required. For instance, Colombia has used its nationally adapted multidimensional poverty index, MPI, to identify households' vulnerability to COVID-19 at the subnational level by using MPI georeferencing. This is quite phenomenal. And this allows the government to obtain precise knowledge of the geographical distribution of multidimensionally poor households, then linking the MPI results to preconditions such as previous morbidities, intergenerational households, or critical overcrowding. The government of Colombia has been able to identify the families with higher vulnerability to COVID-19 and with precision. This information is being used now as a targeting tool to make sure no one is left behind. I really recommend everybody to look at the Colombia model. Honduras. Honduras' innovative monetary transfer program for informal and self-employed workers affected by the social containment measures of COVID applies a multidimensional approach to poverty. 6 dimensions are considered: high-risk populations, health, food, housing and services, economic resilience, and livelihoods and job security. The deprivation profiles are then used to prioritize the poor and vulnerable who become the program's first beneficiaries. And Honduras one is also one that I recommend everybody to read and be inspired and then emulate. Now, Pakistan. Pakistan's socioeconomic response to COVID-19 included a multidimensional vulnerability index, an MVI, which is quite unique. And the MVI identifies areas where COVID-19 impact has been more severe and that would demand urgent action. The index, the MVI index, contains indicators to highlight the pandemic's impact on food insecurity and malnutrition. Results indicate that rural areas in Pakistan have been hardest hit by the pandemic, with many districts facing food insecurity and a high share of multidimensionally vulnerable population. So these are examples I really would like all the audience to review and be inspired by, and then use them to emulate them in your countries. In closing, let me share a few points. As countries move forward to design a recovery process, countries must look at the response through an equity lens. And that is extremely important because inequity has been widening, and we have seen in many countries, because of the widening of inequity, the destruction of social contract, and that has been creating a lot of unrest, civil unrest in many countries. 2, countries, communities, and groups already lagging behind will be the hardest hit. Leaving them further behind will have a long-term impacts in advancing human development. You remember I said that we are regressing some 6 years in terms of human development. So we have to climb a steep path forward if we want to redress that. So targeting those further left behind is extremely important. Last but not least, countries must follow a coherent multidimensional approach. Since the crisis has multiple interconnected dimensions, health, economic, and several social aspects, a systemic approach is needed, rather than, and we have seen it in some countries, a sector-by-sector sequential approach. So that systemic approach is extremely essential and critical. And here again, a multidimensional approach to poverty has a lot to offer. And thank you again for taking these classes. And I trust that you have been empowered and you'll be champions and influencers in ensuring that we defeat this pandemic. Not only we defeat this pandemic, we set our economy back to much better development tracks. And this is doable. I count on all of us. And thank you again for attending these classes. Thank you.